The next epidemic is here. That is what we are hearing. That is what experts are now telling us. Well, look at this. It says Chinese hospitals are housing another deadly outbreak. But according to experts, according to the World Health Organization and the CDC, they say nothing is to worry about. We are perfectly fine because this is just in China. It is not going to spread. Do not worry. But then just today, which is November 28th, we get this. Childhood pneumonia surge reported in Netherlands amid outbreak in China. Doctors weigh in on potential causes of respiratory illness uptick. No one wants another pandemic. What are we doing? What is happening? Can we believe what the World Health Organization is telling us? Can we believe what the CDC is telling us? Here in the United States, one of the things that we are concerned with is we are now getting back to normal. And now we could see another epidemic. This is a huge problem. So today, I want to address what's going on here, why we are concerned, and what some experts are telling us. I'm going to give you my thoughts as well and explain exactly what you should do. So, make sure you do one thing. It takes just 2 seconds. Go ahead, hit that like button if you want more updates on this mysterious pneumonia that is coming from China. But let's begin. Now, I know this mysterious pneumonia has been going on for a little bit. It is now picking up a little more steam. There's more children and elderly inside the hospitals in China. However, we were being told that this is pretty much specific to China because the Chinese people were so, they're just being locked up, okay? They were being quarantined. They were required to wear masks, and many still are. You can even see the pictures here where these people are wearing masks right here on the steps. Do you know why they're waiting on the steps inside this hospital? Because there's nowhere else to go. The rooms are full. People are lining up out the door just to be treated. That's the concern. But we were told it's not going to hit us here in the United States. It is very specific to China because of all the quarantining that they had to do. That their immune system has been compromised. That's what we were told. Yet a report comes out, and multiple reports come out, saying that we are now seeing an uptick in childhood pneumonia in the Netherlands. Why? How? Well, here's the concern. What we just got over with Thanksgiving. We just got over with this, the first of the holiday season, right? Here's the concern. People traveled. People traveled back to China. They traveled from China to the United States. They went, to different countries as well to go and spend time with loved ones. That's a concern. And what we're hearing is this isn't going to hit us here in the United States. Like, we're okay. And remember this timeline right here. During COVID, the initial stages of COVID, the first reported case was in Wuhan, China, December of 2019. The first case in the United States was, I believe, January 20th, here in Snohomish County, in Washington State, in the United States. 1 month later, okay? That was the concern. Look at this. It says DC area hospitals report uptick in sick visits as global concern for respiratory illnesses grow. That's the concern. Now, we know there's an uptick in flus, the flu virus, and also RSV. We know that here in the United States. But at the same time, the COVID virus, that one kind of changed. Okay, it transformed. And that's what we don't want. We do not want this new mysterious pneumonia to go and transform into something that we cannot control. That's, again, part of the concern. This is also why the U.S. is sounding alarms after the new Chinese pneumonia outbreak, because it's raising serious questions as to how concerned should we be. Because, again, the World Health Organization and the CDC are both saying that, don't worry, This is nothing new. Okay? It's not a new strain. There's no new pathogen. We are perfectly fine. That's what they're saying. But let me ask you this. You could answer down in the comment section below. Do you believe the CDC? Do you believe the World Health Organization? And are you going to do what they are telling you to do? The majority of people are probably going to answer no. Because the last time they told us we didn't need a mask, don't worry. Then we found out, no, we needed masks, but the US government and the CDC and Dr. Fauci, they were all concerned that if they told the American people that you should probably wear a mask, you should probably wear an N95 respirator, that the American people would go and buy them all, and there'd be not enough for doctors and nurses and hospital personnel. So they were looking after those people. Again, who do we believe? Now, the CDC does speak out of this Chinese mysterious pneumonia. Okay, and I'll explain a little bit of that in just a moment. But first, I want to go over this. It says 5 questions about the latest disease outbreak in China. One of the questions, okay, is this a new virus or immunity debt? Now, I want to be very clear. This is saying that the U.S. saw a similar outbreak last year after ending formal pandemic precautions. We saw flu, COVID, and RSV. They all peaked about the same time, and they call this a triple-demic. Okay? The term immunity debt, this gained traction to describe it, and China might now be paying back its debt on a delayed schedule. Okay? The result of maintaining COVID lockdowns longer than other countries. And it could happen. That could be an answer. But at the same time, is that something that we want to just assume? Right? That's part of the issue. The other question, how high is the risk of global spread? Now, here's what we were being told. We were being told that this is not a new pathogen to date. We should not worry. The outbreak that is happening is very localized to China. But then when we see things like this in Netherlands and this in Washington, D.C., that doesn't sound localized to China. And that's why we need to be concerned. The other issue is there a risk of global spread? Yes. Because what are we coming up on? We're coming up on the holidays, the main holiday, Christmas, where families travel and they go see relatives and their family in another country. And if you're coming from China, you're going to China or whatever, it doesn't matter. All it takes is one person. It takes one person. We saw that with COVID. We saw that with the last pandemic. All it takes is one person to decide, all right, I'm going to go there. They catch it. They go somewhere else. All the people that they're around now are infected or potentially infected. And then those people go to their families and they're infected, and it spreads and spreads and spreads. That's a concern. So yes, this could hit us on a global scale, but it will take some time. Here's the other thing. What should the U.S. do to be prepared? That was one of the questions. It says increase hospitals' surge capacity, especially for children, experts say. Most children's hospitals in the U.S. run at capacity even in good times to survive economically. That is part of the issue. I live here in the Seattle area. We have the Seattle Children's Hospital, okay? Which is a very good hospital. But they are always busy. Always busy. So if we had a shortage of nurses, shortage of doctors already, what is this uptick in cases potentially going to do? It's going to cause panic, concern. The other issue we're having, and this is a worldwide issue, is we're now seeing a shortage of medications, right? This is something we've experienced over the past year or 2 years. A shortage of medications. We can't do that. Now, I want to read you this. This is from this morning. It says, CDC speaks out over China's pneumonia outbreak as concerns grow. It says, the Centers for Disease Control and Prevention, the CDC, is communicating with health officials in China as fears grow over an outbreak of infectious respiratory diseases that can cause clusters of pneumonia among children in the north of the country. Okay? It says the U.S. CDC has collaborated with its Chinese counterpart for over 30 years on a range of diseases that circulate among the global population, including influenza and tuberculosis. It says concerns were raised by the World Health Organization last week that China was not sharing adequate information with the international community about the rise in respiratory illnesses, which had been reported in the media and on a global outbreak surveillance system, something it was previously criticized for in the early stages of the COVID pandemic. That is part of the issue. We currently have, the tensions are high between the United States and China, between President Biden and Xi Jinping, the president of China. But can we come out and say that China's withholding information? That's probably not something the Biden administration wants to do because the tensions are so high to start. So that right there is another concern. Is China giving the World Health Organization all the information that they have? We knew in the beginning stages of the COVID pandemic, they weren't doing that. And so why do we think 3 years later, they're going to do that again? Technically, actually 4 years later, excuse me. That is the concern. So this new pandemic, this new epidemic that China is facing, could this hit the United States? Yes. And my assumption is it's already here. So be prepared. Be ready, be cautious, but that is what we know. So again, thank you guys for watching. Do yourself a favor, do your friends and family a favor as well. Share this video with them on Facebook so they too know what is going on and should they be concerned about this mysterious pneumonia. If they have children or not, doesn't matter. This could spread very quickly. So again, thank you guys for watching. Consider subscribing and I'll see you guys on the next one.